Hi, I'm Patricia Greenberg, and here we are talking about all things aging well. So, my guest today is Dr. Xiuling Ma. She's an acupuncturist in Beverly Hills, California, with over 30 years of experience in the field. Just want to tell you a little bit about her. And yes, full disclosure, I do see her for my acupuncture. She has advanced degrees from China. She's one of the most highly educated professionals in the field of Chinese medicine, both in China and here in the United States. She graduated first in her class from the prestigious Beijing University of Chinese Medicine and completed 12 years of education in integrated Chinese medicine and Western medicine. We'll talk a little bit about what she does. So welcome, Dr. Ma.
Thank you, Patricia. Thank you for having me here. It's a pleasure.
Yeah. So you do a couple of things. You practice as an acupuncturist, and I know you have an MD in China, and you also have a school, right, where you train other acupuncturists coming up.
I teach at
Okay.
UCLA in the past. I also taught different acupuncture schools.
Very nice, very nice. I always say the teachers know more. Always.
It's a
So
learning
I,
process
I
too.
want to start out by the basics, which I know seems so simple, but people always say to me, what is acupuncture? What do they do when you go there? What does it feel like? So we'll talk about all those things. But first, I just really wanted to basically talk to our audience, like, what is acupuncture?
Acupuncture is one of the treatment modalities of Chinese medicine. And Chinese medicine, including acupuncture, massage therapy, Chinese herbal medicine, also TCM nutrition, and other mind-body exercise like a qigong and tai chi, those kind of things. So acupuncture is one of the main components of Chinese medicine. And so acupuncture basically originated in China, started like 2,500 years ago, and involves insert a very thin, fine needles into the body and stimulate those points either manually or through a electrostimulator. So by stimulate those points can help restore the flow of the qi and promote healing and prevent disease and treat certain conditions and disease.
So, Dr. Ma, it's appropriate for any age. Is it common in Chinese medicine to administer acupuncture to children?
Yes, yes. And in children, actually, we don't, if children is too young to cooperate, we actually don't leave the needles in.
Okay.
We try to actually do quick needle. The needle basically is one needle in the practitioner's hand and in and out stimulate the points.
So tell us a little bit about that. We've heard about that, the flow of energy, opening it up, meridians to get healing to areas of the body that someone is struggling with. Is it appropriate well, let's talk about how the flow of energy happens.
And in the human body, we believe there's meridians. There are the points on the meridians, and the energy actually run through the meridians connected with the internal organ. So the qi is a very important concept of Chinese medicine, translate into like a vital energy. And by stimulate these points can restore the flow of the qi, because when the qi is blocked or disrupted, and the disease will occur. By restore those flow of the qi can help actually restore health. And their modern research believe, the modern research actually found by stimulate those points directly connected to the central nerve system can help promote secretion of endorphin, dopamine, serotonin, all those like biochemicals, and try to get those biochemicals release more, have balanced the body, and actually try to stimulate the healing power, help the body actually trigger the healing ability of a body.
Okay, so we have this where you go in and you have needles put in, and a lot of people don't understand it. So let's just go back for a second and talk about the flow of energy and the meridians and how that actually works in the body.
Acupuncture is based on the concept of the qi. Qi is the vital energy, which flows in the human body called like meridians. There's meridians, there are acupuncture points. So according to Chinese medicine, when the qi is blocked or disrupted, the disease will happen. So by restore the flow of the energy in the human body can restore health, treat disease. And acupuncture actually is believed to work by like stimulating specific points on the skin, and we call that the points, and which in turn triggers the central nerve system. So the central nerve system will release some chemicals like endorphin, dopamine, serotonin into the muscles, the spinal cord, and the brain. So this biochemical changes by stimulating the body's ability to heal, we call that the healing power, and to promote the physical and emotional well-beings.
I love that it covers a lot of things, and I had so many questions, what to expect and what's the primary function. I know this is a loaded question, Dr. Ma. Does it help everything? I'm a devotee. I go around telling everybody acupuncture cures it all, but tell me about the limitations also.
Yeah, acupuncture combined with other treatment modalities, what I mentioned earlier, can help a lot of conditions. Remember, Chinese medicine been existing for a few thousand years. Western medicine went to China less than 200 years ago. Before Western medicine, we do use Chinese medicine, including acupuncture, to treat the quarter of the world population. And with that said, but it's not for everything. There are definitely limitations. Every treatment modality, including Western medicine, have its limitations. There are definitely limitations. So that's why I do believe in integration. Integrated, the Chinese medicine or alternative medicine with, Western medicine provide the best care for patients.
So I wanted to ask you, and we could talk a little bit more about the details of what it can help. How often should one go to acupuncture? And is that again dependent on what you're going there for? I mean,
yeah, of course.
Can you have too much acupuncture, I guess is what I'm asking.
There actually depend on what condition you come for, and also how severe the condition is, how long the condition has occurred. So it really depends, and you can come 3 times a week with urgent and severe pain, or you can come once a week, or you can come a couple times a month. It really depends on the condition and the severity of the condition.
I want to shout out to the audience to tell them that I do, and again, thank goodness I'm well, and I use acupuncture and massage for stress and strain, and sometimes my athletic injuries and so forth. And it's for anxiety and stress. It's been phenomenal. I'm going to be a commercial for you for a little bit, Dr. Ma.
Yeah.
But I am terrified of needles, and I have to tell you, I got through that. And so that's why my next question to you, Dr. Ma, is, I guess it's twofold. You have people that are afraid of needles, right? So that's probably in itself a learning curve for the patient as well as you to get that person through it. But also, are there parts of the body that if someone has a bleeding disorder or a certain condition that they shouldn't be having needles inserted?
Of course, there are actually contraindications.
Yes.
If patient have like a bleeding disorder and you don't want to get acupuncture, especially when the condition is severe. And also there are certain points during pregnancy, because we do treat, women's health and fertility included, and we do treat pregnant women. And but there are certain points shouldn't be done when a person is pregnant.
What's the protocol for right after a treatment? I think we'd all love to go have an acupuncture treatment, then go home and get in bed and lay down for 2 hours, but that isn't the most practical. Is there anything you should absolutely not be doing before or after an acupuncture treatment? Is it meant for after you've done the workout or after you've had a long day or first thing in the morning? There's probably no hard and fast rule, but is there anything you shouldn't do right afterwards? Rigorous exercise or?
Definitely, you should avoid strenuous exercise right after acupuncture because it's energy work. So the energy try to unblock the stagnation, and sometimes patients feel a little bit tired after treatment. So exercise in moderation is okay, but strenuous exercise should be avoided. Also, shouldn't drink alcohol or too much caffeine before and after acupuncture is recommended. Avoid caffeine, try to avoid caffeine. And also after treatment, should drink some water and because they're, release the toxicities you want, flushed out the toxicity. So drink enough water is recommended also after the treatment.
And you should be drinking enough water anyway. And I have my water bottle
Yes.
here with us as much as possible. Why is it considered alternative medicine in the United States when it's such a widely accepted practice in China as a form of primary treatment? Where's the disconnect there between Western and Chinese medicine that it isn't a frontline?
I think the history, right? We had Chinese medicine for over a few thousand years, and we've been using it along Chinese medicine along until 200 years ago. Western medicine went to China, so it's it is deep into the Chinese culture, and people actually grew up here. Their grandma talk about the tea and the heat. And you need to use cooling food, treat the heat condition, the warm food, treat the cold condition. Also, a lot of grandma know how to do cupping or gua sha to help, some mild conditions. So it's deep rooted in Chinese culture, and the public is well educated about, Chinese medicine, acupuncture, and herbs. Western medicine, it's dominated in the Western world for a long time. And acupuncture is fairly new and started get popular after President Nixon actually, have this, diplomacy. Started with Nixon, the James Jordan resident visited to China, have the ping pong diplomacy, and popular through some media. And so it's a short history. The public need to be educated. Healthcare professionals need to be educated, and policymaker and the insurance company need to be educated.
Yeah, I have seen now that the insurance companies are much more willing to cover acupuncture, chiropractic, and massage than they used to be. It was unheard of a few years ago. Now, if you go to a licensed, reputable acupuncturist, it will be covered in most cases now. So that's very interesting. Dr. Ma, you train others to be acupuncturists. Can you tell us what the education requirements are? Because it seems like in any other discipline, in any other field, there's a lot of people out there doing it. What is it we look for in someone when we want to have acupuncture treatments?
If you want to become a licensed acupuncturist, and to get into the acupuncture school, you need to have minimum 2 years college education and college credit. Then the acupuncture school, the program itself is about 3 to 4 years, depending on which state you're in. And some states, require less credit. Some states like California probably require the most, like a training. And so after the, go through the program, you need to take the license and to become a licensed acupuncturist. And the acupuncture has its own state exam for acupuncturists, but other states, is a different test.
I like I mentioned earlier, myself and a lot of people tout acupuncture as the cure-all. Anxiety, weight loss, addiction, and chronic pain, management of more serious diseases. So I want to just dispel some myths with which we alluded to earlier. No one thing cures everything. We know that there's a multidisciplinary approach to any disease or illness, or even just when someone has a little something that's off kilter. It isn't always one thing that helps. So let's start, like someone comes to see you like me, and I really don't know what I need. I just want to feel better. What do you, where do you start to evaluate what the patient needs? What are you looking for when somebody comes in?
Of course, we need to have a comprehensive, like a consultation to understand patients' constitution, understand their medical history, and understand what other treatment they went through, what medication they're, on or have tried. And also we check the tongue and the pulse, and that's, help us understand a human's body better. We come up with we call like a, diagnosis, including diagnosis of the disease and diagnosis, like a pattern diagnosis. And then we come, according to the pattern diagnosis and the disease, we come up with an individualized plan to help patient, either with acupuncture alone or acupuncture with others, like, herbs and nutrition and other recommendation, mind, body, exercise.
So unfortunately, you're at the mercy of how honest a person is with you when they come in. Yes. About what's been going on. And
also like sometimes, through, the body's tongue and pulse, also like other observations of the human body. Sometimes, we can tell some patient maybe forget to tell us. And also remember, Chinese medicine is great on like keep a body healthy, well balanced, prevent disease. We focus actually on prevention a great deal. And that's actually a strong field of Chinese medicine also.
Is it safe to say that there's less heart disease and cancer and diabetes in China?
I don't want to come to a conclusion. I have to do more research on that.
That's adopting, we talk about this all the time, the Western lifestyle, and then everyone that comes here starts taking on all the ill effects of, how we eat and how we live in America and so forth. So, as you know, Dr. Ma, our focus here on the show is aging well, but I think everything I talk about here is good for anyone at any age. But, as a person gets older and kind of reaches that point where they say, well, my back hurts because I'm 60, or you're supposed to have aches and pains, or you're supposed to not feel good. You've heard that, I'm sure, a million times. Tell us about that. Is it normal to not feel well because you're over 60?
Not really. I have patients already in their 90s and they do have aches, but is managed well with lifestyle, exercise, proper diet, and some help of like acupuncture and herbs. So everybody is going to get old, but age gracefully is our goal. And 60 is not old, still young.
I can tell you that. I absolutely.
60
Yeah.
in a couple of months.
Yeah. Yeah.
So, and you shouldn't feel like aches and pains after age 60. It's too young to have like. So like I said, prevention and is the key, and that including, well, I say regulate the emotions and de-stress, eat well. That's your expertise, and proper exercise and proper lifestyle, and avoid, like extreme weather, and so keep your body like healthy and balanced.
I want to ask you, just as we're getting near time, is what is the biggest misconception about acupuncture that you would like to set straight?
Number one, you already mentioned, is acupuncture is very painful. Okay. I do have patients, when they came first, they said, oh, I'm so scared of needles. And I say, the needles in your mind is probably a syringe. And
right. Mm-hmm.
Acupuncture needle is a very thin, fine needles. And it's not painful. Most patients don't feel pain. Sometimes you do feel a little bit like achy, and when the needle goes through the skin, but generally speaking, it's not painful. And most of my patients actually take a nap during the treatment. Mm-hmm. And also another thing I want to mention, some people consider acupuncture is not legitimate treatment modality, which is not true, because even in the United States, NIH actually have recommended variety of the conditions can be helped by acupuncture. Also, WHO also recognize acupuncture works for like a different variety of conditions and disease. So it is legitimate.
Absolutely. And I'm here to share that with everybody that it is. Dr. Ma, I want to thank you so much for this highly informative show. And I want to ask you, what do you like about getting older?
Getting older, everybody get old. And getting older, the benefit is we went through life, we had a lot of experience, and we become wiser. And be more like open-minded, and also more like a relaxed, probably can enjoy the interest, the hobby. When we're young, we're like work like very hard, and now we have time to enjoy life. Also, to zen out. Not many things bother us anymore because we sit down, we went through a lot. So,
yeah, and you also know you're here to tell the tale, so you're going to live through it, whether it's big or small. You're still here to tell. So I wish you all the best. It's nice that you have a birthday coming up, that you still feel young, and I think that's wonderful. So Dr. Ma, again, thank you so much for your time and expertise. And for more information about Dr. Ma and acupuncture, you can go to www.acupunctureworld.org. And thank you all again for listening to Eat Well, Live Well, Age Well. Please tune in again for our engaging discussions on all things aging well. And for feedback and topic requests, you can contact me at www.patriciagreenberg.com. Thank you again, Dr. Ma. It was such a pleasure to have you here.
Thank you very much. It's my pleasure.